I'm super excited. I'll be taking over Nurse.org on February the 22nd. But first, who am I? I'm Courtney, a registered nurse of 10 years. I started my career off in an emergency department in Atlanta, Georgia. I migrated to California via travel nursing, obtained my master's in 2016, and since then I've held a variety of positions, including assistant clinical director, administrative house supervisor, clinical instructor, and also assistant nurse manager. I spend most of my time now in the critical care setting. My specialty is medical ICU, but don't get it twisted. I can float to any unit. I am very passionate about mentorship and nurse education, so stay tuned February 22nd as I take over the stories of Nurse.org. To answer this question, I started my career out in the emergency department in a level 1 trauma center. We were extremely busy. We saw maybe 150,000 patients per year, which is around 450 patients per day. I stayed at that job for roughly, I want to say 14 months before I became a travel nurse. I know that a lot of people say that is quite early. But when you're in a large level 1 trauma center that's seeing that many patients, you're going to see a lot of different complaints, a lot of different cases, which is going to prepare you for becoming a travel nurse. This is a great question, and what I will say is that I absolutely love nursing because of the versatility. We have the ability to work in so many different capacities, and depending on where you're at in your life, you can find a job that will fit in. So I wanted to get on the administrative side to kind of learn how hospitals work and how they function. At one point in my life, I felt like I wanted to be a chief nursing officer. Now I'm more driven by the clinical aspect of nursing, and my goal is to get into CRNA school at this time. So I went back to the bedside to obtain the necessary clinical knowledge I needed, and I'm submitting applications. So that's what's bringing me back to the floor now. Very good question. So any nurse can actually be a consultant. You just have to have something to actually consult about. For instance, you could be a magnet consultant. You can help hospitals achieve magnet status. Or you could be a consultant, legal nurse consultant, which will require you to get additional specialties and training. But a nurse practitioner is an advanced practice nurse. You are going to have to get an advanced practice degree for that, and you're going to have to sit for a state license exam. So is the ED and ICU similar? Yes, they have similarities. Most patients are going to arrive in the ED and are going to end up in the ICU. So you're kind of caring for the same disease processes. In the ED, you patch them up. I always say you know a little bit about a lot. When you go to the ICU, you learn in-depth knowledge about disease processes, in-depth knowledge about your medications. You learn how to titrate medications. You learn what receptors are working on. You learn how quickly they work. In the ED, we kind of just start those things. We have a little bit of knowledge about it, but as you get into the ICU, you kind of grow a more well-rounded view of things. Also, the biggest difference that I can tell is that in the ICU, you're kind of patching things up. You're putting things in perspective for your patient. You're teaching them how to deal with the aftermath of their trauma or their injury or whatever it is that caused them to come into the hospital from the beginning. Hey guys, I am back again on Nurse.org. Today I'm off. I want to show you what I do on my day off. I work night shift at my travel assignment, and I have a per diem job that I still work day shifts. I'm gonna go there tomorrow. Hence the reason I look a hot mess. I haven't had time to really get my eyebrows done, my hair done, things I like to do for myself. But one other thing that's very important to me is self-care. So I'm about to head to the gym. I usually like to go for an hour, 3 days a week, hour and a half if I'm lucky. But what questions do you guys have about continuous education? I'm in the process of going back to school, and I know you're like, why? Because our goals, they change. And so they shift throughout our life. So you may at some point want to go back to school. I want to say that Nurse.org has a lot of information about continuous education. So if you have a moment, check it out. Look at their section on education. It's so helpful. It has helped me out a lot. But what questions do you have today? Continuous education.
She traveling, paid it in full. She going bedside to cosmetics now. Aesthetics, she in it so heavy now. She working so hard, but no matter route. I do it for nurses, they love my sound. 'Cause you know I gotta turn.
So my takeover is coming to an end, and I really enjoyed you guys. I want to answer one last question. It was about how my day looks in the ICU. I start my day off with bedside report, I can quickly look at my patient, see how their respiratory status is, check their vital signs, which is going to give me an idea of hemodynamics, and I look at my drips, make sure I have time to buy before I need to hang something else. After that, I look over my patient's chart. I try to make sure all medications have been given from the previous shift, and then I just kind of outline my day. My plan can deviate depending on if there is something going on with my patient. That's what's important about being a nurse, is being able to adjust and adapt to change. You're going to do that all day throughout your shift. I want to also tell you guys that Nurse.org has some wonderful resources out there. So if you want to get into different specialties, they have you covered. They let you know what each specialty does and what you can expect as a nurse. I am Nurse Lamb, RN. Please follow me.